physical therapy after high ankle sprain. If death and taxes are the top two on the list of events likely to happen to all of us, sprained ankles are a close third, at least among those who participate in sports. The ankle is the most frequently injured part of the body among athletes. The severity of the injury ranges from one that allows the person to return to normal activity in a few days to an injury that keeps a person out of action for weeks at a time. And those who have had a sprained ankle are the ones most likely to suffer the same injury again and again and again. How it happens. A sprained ankle is a stretch, tear, or rupture of at least one of the ligaments that hold the bones of the ankle joint together. The tears may be microscopic in size or so large that they represent a complete disruption of the fibers. One of the ligaments that wraps around the outside of the ankle is the weakest of the ankle ligaments and is the one most frequently injured. It is possible that all three ligaments supporting the ankle, from front to back, may be sprained. The vulnerability of the ankle as a structure causes the foot to move like a badly mounted wheel. The most common cause of a lateral, outside, sprained ankle is when an athlete rolls over on the outside of the ankle, forcing it to move beyond its normal range of motion. Common scenarios include trying to change directions when the pivot foot is in a fixed position, landing on an uneven surface, and being out of control when landing after a jump. All three situations often occur in basketball. Interestingly enough, says Steve Smith, a physical therapist at Athletes Performance in Florida, some research has shown a correlation between weak gluteals, buttocks, and the incidence of ankle sprains, possibly due to a lack of stability and control. Ankle sprain versus high ankle sprain. The dreaded high ankle sprain differs from a standard ankle sprain according to the ligaments that are involved. In a standard ankle sprain, the ligaments that connect the bones in the lower leg to the foot and ankle bones are injured. But in a high ankle sprain, the ligaments that connect the two lower leg bones together are injured, explains Ramin Mataber, MD, Chief of Orthopedic Surgery, St. John's Health Center, President, Santa Monica Orthopedic and Sports Medicine Group, Santa Monica, California. Naturally, the location is higher up the leg. Mataber says high ankle sprains are usually associated with a higher degree of injury and require a longer time to recover and return to sport. That's because the forces on these ligaments are greater and they need to be healed before athletes can tolerate running, jumping, and cutting. Another reason for the longer time to return to sport, says Mataber. Standard ankle sprains allow return to sport in days to weeks, while high ankle sprains can be weeks to months, he says. Who's at risk? Basketball players are at the highest risk, with sprained ankles accounting for more than 40% of all basketball-related injuries. They are also the most common injury, though at a lower rate, among volleyball, soccer, tennis, football players and others who participate in running and jumping. Symptoms. The amount of pain depends on how much the ligament has been stretched or torn. Physicians categorize ankle sprains according to the severity or degree of tissue damage. Grade 1, mild pain, tenderness, localized swelling, but no instability. The person can walk, but is limited when trying to jog or jump. The ligament is stretched but not torn, and there is some damage to the ligament fibers. Grade 2, a tearing or popping sound of the ligament as the ankle rolls to the side. Significant bleeding and bruising, sometimes developing 3 to 4 days after the injury. Moderate tenderness and swelling, decreased range of motion. The ligament is partially torn and the ankle is abnormally loose, difficulty in walking. Grade 3, extreme pain, swelling and tenderness, major instability, difficulty in walking. Feeling of the ankle giving out, the ligament is completely torn. Initial treatment. Rest 24 to 48 hours to prevent further damage. Apply ice packs for 15 to 20 minutes, 3 to 4 times a day for the first 24 to 72 hours. But don't apply ice directly to the skin. Use an elastic bandage or wrap to limit swelling from the base of the toes to the top of the calf muscle for the first 24 to 36 hours. Protect the ankle with an air brace or other ankle support device. Elevate the leg ankle higher than the trunk to limit swelling 2 to 3 hours during the day. Use pillows at the foot of the mattress or elevate the end of the bed with securely placed books or blocks of wood. Aspirin, ibuprofen, and naproxen may relieve pain and reduce inflammation.